against it already. I've no
also on that discussion were 3 GPs, and I spent a little bit of time saying to those GPs that the NHS is not about them. Most of them, you know, think the whole National Health Service relies on them and is about them. What I want you to do today is join with me and celebrate the hundreds of thousands of NHS workers who actually provide NHS services. So I gave these GPs an A to Z of NHS workers. So give a shout when you know a worker who's doing this type of work in the NHS. So let's start with ambulance workers, ancillary workers, building workers, cleaners, catering staff, dietitians, epidemiologists, that was hard to say, engineers, estate staff, finance staff, gastro technicians, healthcare assistants, health visitors, housekeepers, information management staff, joint commissioning officers, knowledge and skills staff, laboratory assistants, laundry staff, managers, come on, there's some managers, matrons, mental health staff, nurses, nursery staff, occupational therapists, orthotists, porters, planners, paramedics, physios, quality officers, that was a tough one, the queue. Okay, reception staff, record staff, radiographers, student nurses, social workers, secretaries, technicians, trainers, ultrasound staff, now you wait for that one, van drivers, ward clerks, x-ray staff, youth workers, and last but not least, the zillions of hours that you, as underpaid health workers, provide to make this service operate. Okay. Security staff, sorry I forgot security staff. We could be here all day now because people are shouting out people I've forgotten. Sorry for anyone I've forgotten. But the main point I was trying to make was, and the main point I made to Radio Merseyside was, if the health service was just about GPs, we'd be in a sorry state. It's about all of you health workers. And it's also about patients. It's about patients and their families. It's about carers. And I'm saying to you now that with this NHS, which was born out of the struggle of working people, born out of the struggle for a better life, we need to celebrate it. And we are the people who can celebrate it, because you, as the workers in the NHS, provide those services. It isn't perfect. We know it isn't perfect. But it's the best thing that any government ever did in this country. And we've had 62 years of an NHS, and we're not going to let it go away as a result of a coalition bill, which has to be defeated. So, as I said earlier, when you go away from conference this week, be inspired, be encouraged to go back to wherever you're from and fight to keep the NHS we love, the NHS we're determined to keep. Now here in the NHS, there's 69,000 UNISON members in the Northwest. There's 400,000 UNISON members in the NHS nationally. And that's what we're proud of. We're proud to be UNISON members, we're proud to be NHS workers, and we're not going to let the Tories unpick 62 years of an NHS. Thanks, comrades.